Picture this. You're feeling grumpy and tired more often than usual, you're having headaches, problems thinking or concentrating, and then, later on, you start to notice that you have brittle nails, lightheadedness when you stand up, a pale skin color, shortness of breath, and even a sore tongue. What do you do? Well, those are all common symptoms of iron deficiency anemia. My name is Rakshan Cameron, and today I will be talking to you about that disorder. First, let's start off by defining what anemia is. Anemia is a condition in which the body does not have enough healthy red blood cells. As many of you probably know, red blood cells provide oxygen to body tissues. Therefore, anemia can be a very serious disease, as many of your vital functions require oxygen. Other types of anemia include anemia due to B12 deficiency, anemia due to folate deficiency, anemia of chronic disease, and sickle cell anemia. However, today I will be focusing on iron deficiency anemia. Iron deficiency anemia is when your body does not have enough iron, as explicitly stated in the title. Your body will make fewer red blood cells, or even red blood cells that are too small. Like I mentioned before, red blood cells bring oxygen to the body's tissues. Healthy red blood cells are made in your bone marrow, and red blood cells circulate through your body for 3 to 4 months. Parts of your body like your spleen remove old blood cells. So, how is iron related to blood cells? Well, iron is a major component of hemoglobin that carries oxygen to all parts of the body. Iron also has a critical role within cells, assisting in oxygen utilization and somatic systems, especially for neural development and overall cell function everywhere in the body. Thus, iron deficiency anemia affects all body functions. Your body normally gets iron through your diet. It also reuses iron from old red blood cells. Therefore, it is extremely important to get the daily recommended intake of iron. This is 11 milligrams per day for infants, 7 to 10 milligrams per day for children, 8 to 11 milligrams per day for males aged 9 to 70, and 8 to 18 milligrams per day for females aged 9 to 70. For females in pregnancy, they need far more iron. In fact, 27 milligrams per day. I will discuss the reason for this later. You get iron deficiency anemia when your body's iron supply runs low. This can occur because you lose more blood cells and iron than your body can replace, your body does not do a good job of absorbing iron, your body is able to absorb iron but you're not eating enough foods that contain iron, or your body needs more than the normal supply of iron, such as if you're pregnant or breastfeeding. Bleeding can also cause iron loss. Common causes of bleeding are heavy, long, or frequent menstrual periods, cancer in the esophagus, stomach, or colon, the use of aspirin, ibuprofen, or arthritis medicines for a long time, which can cause gastrointestinal bleeding, peptic ulcer disease, or your body just may not be able to absorb enough iron in your diet due to celiac disease, Crohn's disease, gastric bypass surgery, taking too many antacids that contain calcium, and finally, you may not get enough iron in your diet if you are a strict vegetarian, or if you're an older adult and do not eat a full diet. So one common theme throughout all the information is that diet is extremely important in preventing this disease. Some foods that are rich in iron are chicken and turkey, dried lentils, peas, beans, and even fish. Liver is the highest source of iron. Furthermore, in addition to the symptoms I mentioned at the beginning of this video, you may have iron deficiency anemia if you have dark tar-colored stool or blood, heavy menstrual bleeding, pain in the upper belly from ulcers, or weight loss if you have cancer. The blue color, feeling weak, problems thinking, and darker blood color are due to the lack of oxygen your tissues are getting from the lower count of red blood cells. Infants and young children need a lot of iron to grow up, and therefore they are more at risk for developing iron deficiency anemia. Premature and low-weight babies, teens, and even women are more at risk as women have blood loss during their monthly periods. Incredibly, about 1 in 5 women of childbearing age has iron deficiency anemia, as they need extra iron for increased blood volume and for the fetus's growth. The condition can increase a pregnant woman's risk for delivering a premature or low birth weight baby. Vegetarians also could have iron deficiency anemia more frequently, as their diets do not include meats, even though they may consume eggs or dairy products as compared to omnivorous children. Care should be taken to ensure that foods containing iron are always included in the diet. Black women have a lower mean hemoglobin and a wider standard deviation than white women. even after adjustment for iron status. There is a high rate of iron deficiency anemia among Mexican women as well that is not accounted for by dietary intake, suggesting there may be an unidentified, possibly racial factor predisposing these women to iron deficiency anemia. To diagnose anemia, your doctor may order a hemoglobin test, and to check iron levels in your blood, the doctor may order a bone marrow exam, an iron binding capacity, also known as TIBC, in the blood, or a serum iron level test. Tests that may be done to look at the cause of iron deficiency may include a colonoscopy, a fecal occult blood test, or an upper endoscopy. Treatment may include taking iron supplements and eating iron-rich foods. In order to maximize iron uptake, these foods should be taken at the same time as those that are a good source of vitamin C, such as orange juice, tomatoes, bell peppers, or strawberries, as vitamin C enhances iron absorption. Iron supplements are needed to build up the iron stores in your body. Most of the time, your doctor or nurse will measure your iron levels before starting supplements. If you cannot take iron by the mouth, you may need to take it through a vein, also known as intravenous, or by an injection into the muscle. Your red blood cell count should return to normal after 2 months of iron therapy. You will need to keep taking iron for another 6 to 12 months to replace the body's iron stores in the bone marrow. Notwithstanding the high prevalence of iron deficiency, excessive iron intake is also a source of adverse effects. In fact, iron overdose is the leading cause of poisoning deaths in children under the age of 6. Adverse effects are usually seen with intakes between 20 and 60 milligrams per kilogram, and depending on the quantity of iron ingested, the cardiovascular system, central nervous system, kidneys, liver, and hematologic system can be affected. With treatment, the outcome is likely to be good. However, it does depend on the cause. To prevent iron deficiency anemia, simply have a well-rounded diet, including enough iron. Red meat, liver, and egg yolks are high sources of iron. Also, flour, bread, and some cereals are fortified with iron. Finally, take iron supplements if you aren't getting enough iron in your diet. And call your healthcare provider if you notice symptoms of iron deficiency or if you notice blood in your stool.
So I knew I had iron deficiency anemia by my fingernails turning purple, and I was just really cold all the time despite the fact that it was really warm in wherever I was. After recognizing my symptoms, I went to the doctor and I was diagnosed with iron deficiency anemia. So he prescribed me iron supplements and told me to watch my daily iron intake, which is incredibly important because I am vegetarian. So as well as the iron supplements, I also ate foods high in iron such as soybeans, blackstrap molasses, and broccoli. So after having treatment for about 4 to 6 months, I was beginning to feel less tired, I was warm finally, and everything started to feel a lot better. So I'm thankful that I was able to diagnose myself with iron deficiency anemia. Now that I'm cured of iron deficiency anemia, I'm watching my diet more closely by pairing iron-rich foods with vitamin C and keeping track of my iron, not as much as I was before, but just making sure I am getting those foods that are high in iron.